Welcome to this short documentary featuring a question and answer session with Dr. Amy Henderson, the Director of Research Evaluation and Impact at Population Media Center Headquarters. In this session, we delve into pmc-e's innovative approach. Who is Dr. Amy Henderson? She serves as the Director of Research, Evaluation and Impact at PMC Headquarters. Her illustrious career includes teaching at Thomas Jefferson University and chairing the advisory board for Bill and Melinda Gates Foundation project on social and gender norms for adolescent girls and young women in sub-Saharan Africa and Southeast Asia. Renowned for her dynamic teaching, Dr. Amy is a co-author of Health Communication Fundamentals and has led UNICEF's SCBC theory and practice course. In this documentary, she discusses PMC's headquarters technical support to the Ethiopia country office, highlighting the strategic research-driven methods and the multimedia social behavioral change, education and entertainment initiatives and theory of change that are making a significant impact on the communities.
Our training was to work with our local research partner that's been hired to collect data on behalf of the project. And we spent 2 days together, a full and busy 2 days, going through the exact protocol of the inline evaluation. How will we select participants? How will we gain their consent? Who do we need to talk to in the community before we go out and collect data? As well as, what is each question that is involved in the survey, as well as in focus groups? How will those questions be asked? And will we ask all of those questions consistently across areas? So this is something that we do for all of our PMC projects whenever we collect data, which we do in partnership with consultants, research firms, and universities. We have these standards that underlie our research approach. And so by being here, we were able to go through those standards, how the questions will be asked, how the data will be collected, how we will receive the data, and together how we can interpret the results and move the work forward. So for 2 days while here in Ethiopia, we've had the opportunity to work with the PMC country staff to develop a theory of change for a brand new project that we're starting with DKT, our gracious funder. We've been able to spend this time together, most of the staff together with us, around the table, brainstorming and thinking through what is it that we hope to achieve with this program and how are we going to get there. So a project-level theory of change is a roadmap for a project. It's a visual diagram that describes what are the inputs and the activities and what are the outputs and outcomes that we expect from our program. And it's important at the very beginning of any project to be aligned. Where are we starting from? Because if we get to the end of the project, how will we know if we cross the finish line if we don't know what the finish line is? So a theory of change is an exercise and an opportunity to come together. So I've been very lucky to work with the team here who brings an extraordinary amount of experience in this country office talking about this new project, the activities that we plan to undertake, and how we will evaluate the program. And so right as we're recording this, the team is still working on the theory of change around the table with their paper and markers, figuring out exactly what those components are. Of course, a draft theory of change is not the end of the story. A theory of change is just that. It's a theory. It's a hypothesis of how our project is going to work. So our plan for this project, as we do in other country offices, is to start with a draft theory of change and continue to look at this theory of change over the life cycle of a project. And importantly, at the end of the project, come back to that theory of change. Did the project achieve what we thought it was going to achieve or not? And what can we learn along the way? A theory of change provides that opportunity for us to look inward at a project, to determine what we learned, what worked, what didn't work, what we can share, and how we can continue to improve as an organization. So the idea that there are some new theories, some have components of older theories, some have new approaches. How can we use these in our social and behavior change work that we do here at PMC? Applied behavioral science, human-centered design, and social norms. These are really cutting-edge approaches for social and behavior change that we have used. Certainly we've used social norms here at PMC for quite some time. But making sure that we're aligned with the rest of the field on these theories so we understand what they are, how we can use them, and also from where I sit as Director of Research and Evaluation, how we can use these theories to inform our monitoring and evaluation approaches. How do these inform how we know whether or not our program achieved our objectives or not? So the purpose of tomorrow's half-day workshop is to introduce attendees to the workshop to these newish theories, for everyone to have a flavor of these, and there will be several participatory activities within the workshop in order to start trying the theories, try them on a little bit, like trying on a new jacket, see how it fits, and determine how we can use these, both for ourselves and other SBC professionals in Ethiopia.
During a skill development training session led by PMC headquarter team, Dawar Waraj, country director of DKT Ethiopia, attended and expressed his appreciation for the training. He highlighted his enthusiasm for partnership with PMC, recognizing their extensive multimedia experience.
It is not about a belief of what is right or wrong. It is what gets your attention. If you're talking to youth, young people, they're exploring the field. They want to be safe. They do not want to think all of the complications. We need to get their attention and then tell them what's the best way of doing it, what are the options available, not actually best way of doing it.
PMC Ethiopia, in partnership with DKT Ethiopia, has launched a transformative project focusing on sexual reproductive health, gender-based violence, and peace issues. This initiative aims to produce and broadcast radio serial dramas for audiences across 5 regions.